Suleiman, who is the founder of Gift of the Givers, as well as Professor Mthatha Babaudi, a climate change specialist. On that note, a very good afternoon to the both of you, and thank you for joining us at this hour. Dr. Mthatha, I'm going to start with you, just simply because you are on the ground, and thank you for making time as well. We obviously having heard now the confirmed figure of 86 people having lost their lives, but the search and recovery operations continue. Perhaps you could tell us about the extent of the damage at this point. What's the reality on the ground as we assess what's transpired?
Good afternoon, Lisa. The destruction, we're right on a search site right now. Okay. I'm talking to you from a search site. Gift of the Givers teams combined with SABC are behind me. The Mthatha River, it's got very small now, and it's completely subsided. But above, there's a huge amount of destruction. Many houses gone, destroyed, and right where I'm standing on the side of me, there's furniture, there's fridges, there's corrugated sheeting, there's remnants of homes that came from way on top, all the way down. My teams are gone through mud, and a dog is leading them, an SABC dog is leading them. They've gone right up inside. They've been scouring the area for quite some time. We found 8 bodies over the last 2 days, and of course, other bodies were found by other SABC teams. We brought in a second team. We brought our first team 2 days ago. We brought in a second team yesterday. And also 66 people just turned up from nowhere who wanted to assist and volunteer, who have skills in water rescue. And those 66 people we're taking care of in terms of food, water, and meals, and those kind of energy biscuits. So it's a group, it's spread out over various areas. And because it's so spread out, you can understand how big the area of destruction is. And that's only in Mthatha. There's, of course, big destruction in Butterworth also. In Mthatha, the problem is that the water systems are completely gone. The treatment plant is working, but the 9 pumps that pump out water from there are destroyed. And if you come up on the same road upwards, if you look at the bottom, and the dam's right on top by me, the pipes are destroyed, and in other parts of the city, the pipes are also destroyed. So water is becoming a big challenge. Roads are damaged, bridges are damaged, and up till yesterday, Nelson Mandela Academic Hospital also had a problem. They had to stop all emergency and non-emergency cases coming in. They had to stop elective surgery. For one, the generator was knocked out. Secondly, the reservoir that collects water was empty. And thirdly, they had no water for the patients and for the medical teams. So we intervened immediately. We brought our trucks from filling at the Great Kai from Butterworth, came across. We started filling those reservoirs, and we found boreholes in the area, generous people who allowed us to use their boreholes to fill that whole reservoir, so the hospital now has water. Whilst that was happening, we brought in 30 pallets of water for the patients and the staff. And today we're expecting a generator, a 12.5 kVA, that will power the entire hospital. We arranged that yesterday, and 10 additional backup generators for other health facilities required, whether in Mthatha, in Butterworth, or other parts of the Eastern Cape. That's in terms of the infrastructure and the requirements. So what is a big problem? Roads are a challenge, but I mean, the authorities have been good, directing traffic, making things happen. The city's at work because the malls are busy. People are moving around their business. The people that are really broken are those that have lost their homes and those that have lost their families. And even worse are those that haven't received their loved ones yet to get closure and carry out funeral arrangements.
Yeah, Dr. Mthatha, thank you for that update because, it's been said that in times of disaster, you always have to look for those who are helping. And thank you for speaking to some of those volunteers that have also come on board and, obviously organizations such as yourself. And even if we just look at how long it's going to take to contain the situation or bring it under control, given the various elements, you're also saying the inundation at hospitals and just the lack of supplies and really what is needed at this point. What's your assessment on that front?
Well, before I carry on, right now in this area, the teams I forgot to tell you, are looking for 6 or 7 bodies because a complaint or an information sheet comes into the SABC. The areas are marked out. This area is called Slovo, and the feedback we have is that 6 to 7 people are missing in this area. So the teams are going into the dog to try and find the 6 or 7 people in this area. In terms of what I mentioned, there's additional support that's required, which we did from the first day. Or let's go a little before that. Whenever a level 6 warning or major warning comes through, the provincial government of Eastern Cape, as well as disaster management, MECs, and even the mayors of 6 districts, were virtually on with us to say, you know what, if it happens, we need you guys here. We were already on standby, and everybody did their best, and even the SABC. We have a phenomenal working relationship with the SABC. Right now, we're sharing vehicles, we're sharing teams, we're sharing things together, and we do this all the time. So yes, the first aspect is preparedness to get in, and the cooperation is phenomenal. If there's no cooperation, the disaster can be a major disaster. But here there's such a willingness for everybody to work together in the interest of the people. So on the first day, we came in Butterworth and in Mthatha, helping move people into the different halls. We started feeding. We're feeding 2,000, it's more than that now. We started off with 2,000 hot meals daily, both in Butterworth and in Mthatha. But then there were people who were not staying in the hall. They were staying in their houses filled with mud. But because of no electricity and no water, then they couldn't cook or, had no access to food. So they were also coming to the hall to eat. So we've now increased that feeding to 3,000 people in each facility, and we're not turning anyone away. Besides those, there are others from Butterworth who are away, couldn't access the roads and couldn't come through. So we know there's families stuck, who have no access to the halls and no access to food. So again, working with the SAPS and 4x4s, we managed to deliver 103 food parcels to those families. There's probably more. We haven't heard of them yet, but as we get calls from different areas, we investigate and we intervene. In the halls itself, blankets, mattresses, hygiene packs, personal hygiene kits, water, sanitary pads, diapers, all being distributed to the people in the halls in both facilities, Butterworth and in Mthatha. When I say two facilities, I don't mean two halls. There's several halls in both areas.
Okay. Dr. Mthatha, thank you for painting that succinct picture. Prof. Mthatha, I want to now bring you to the conversation because we've now heard the realities on the ground from Dr. Mthatha to date. And if we're looking at some of those contributing factors and just the causes of what's transpired in the Eastern Cape province, tell us a little bit more about the magnitude of this disaster in relation to climate change, poor planning, infrastructure, maintenance at large. How would you weigh in the same breath, the importance of climate monitoring, early detection mechanisms as well?
Thank you very much. So this is a very nuanced conservation that we need to look at from different perspectives. From a climate perspective, we need to consider natural hazards. Now, things such as floods are natural hazards. It's a naturally occurring process. So we've always had floods, we've always had floods. What climate change does is that it is increasing the frequency and intensity of these natural hazards. So the frequency of floods, the frequency of droughts, and the intensity of these events is increasing because of climate change. But important to note that it is a natural phenomenon. Now, how it becomes a disaster? Becoming a disaster is now an interaction between exposure, vulnerability, and insufficient capacity to cope. So that's where we get into disaster management and preparedness. Because for a natural hazard to become a disaster, there is then the human element which comes in terms of the exposure, people being in harm's way. So in this instance, we're talking about people settling in low-lying areas below flood lines, which then put them in harm's way when the river burst its banks. And then, their homes were destroyed and they were washed away. We also talk about, that is exposure. We also talk about vulnerability, which is linked to capacity to cope, which is then the ability of people to be aware, to anticipate, and to be able to take action to remove themselves from harm's way. And this is where early warning systems come in to help us build that anticipation, to help us be prepared, and to help us to be aware of what sort of actions do we need to take. So Dr. Suleiman mentioned that when there is a level 6 warning or any high level warning, they at a provincial level would be aware and are prepared in terms of response. Now, what we want to transform disaster management in South Africa to, and broadly in Africa, is to be more proactive, so that when we are aware, how do we act in a way that actually prevents loss of life, loss of damage to property, so that we don't transition into the disaster element of these natural hazards. So that is where we need to transform our disaster management and preparedness. And it also means, how do we develop infrastructure so that we are able to divert water from these situations, the sufficient drainage capacity, the drainage systems are not being blocked by people dumping solid waste into these drainage systems. We are taking care and maintaining the natural environment so that it is able to play its role as a natural buffer and, hold these excess rains so that they do not again cause damage and loss of life. And then it's also a little bit more integrated, thinking holistically to how do we support people to recover post the disaster period and to be more resilient afterwards, so that in the future, when this happens again, they are not exposed and they now have adaptive capacity. And that is not just in terms of putting in adequate infrastructure or building awareness through early warning systems. It's also through support mechanisms. The minister mentioned the issue of mental health and trauma that people are dealing with. Our research that we have done has confirmed that there is a heightened risk of mental health, anxiety, and depression associated with these sort of disasters, and the fact that they usually occur and repeat on the same group of vulnerable people because their circumstances do not change in between disasters happening to them. So there's heightened anxiety, heightened depression. We also heard about issues of access to water, which is a hygiene matter for women and children. So those are all things that we also need to be able to better prepare for and build resilience going into the future.
The Eastern Cape Province is a climate vulnerability hotspot. I'm going to leave the conversation there. Thank you, Prof. Mthatha, as well as Dr. Mthatha Suleiman, for your time. Of course, we will continue to monitor developments as the search and recovery operations continue. We're just looking at the impact of the Eastern Cape floods, and to date, having just received the official figure of 86 people having lost their lives. Quantifying, the damages and loss continues. Dr. Mthatha Suleiman, founder of Gift of the Giver, as well as climate change specialist, Professor Mthatha Babaudi, weighing in on the impact and really how we can further mitigate against some of that should further disasters come as a result.